All right, now to some stunning new data about cancer deaths and how many could have been prevented. The new study by the American Cancer Society says nearly half of all deaths were due in part to preventable risk factors.
Yeah, we want to dig a lot deeper into this, so we have ABC's medical correspondent Dr. Darien Sutton here to talk about it. You know, this is pretty startling,
yes,
but there's kind of a silver lining here.
You're absolutely right, because these are risk factors that we can all change today. So in this study from the American Cancer Society, they looked at 30 different types of cancer in adults over the age of 30. And as you said, they found that up to 50% were associated with modifiable risk factors. These are factors and habits and behaviors that we can change. The most common, let's number one, talk about the types of cancer: lung cancer, endometrial cancer, breast cancer, colon cancer. And as far as what factors we can change, smoking was associated with more than 60% of all cancer-related deaths. All is key there. It's not just lung cancer. Also physical inactivity, as well as alcohol use. These are all factors, as well as others, that we can change today to improve our outcomes.
And alcohol use, different by gender in some ways too, the risk.
It is, and that's a study that we reported on previously. If you look at the studies, it seems as though alcohol-related deaths, women are more susceptible to that than men. Some of the reasons: biologically, women have less of an enzyme that can break down the product of alcohol, which exposes them to more of the risk of alcohol. It's unfortunate because a lot of these studies don't include women, and that's another reason why we need to diversify studies to make sure that they include all, so that they can apply to all.
Right? That's a whole nother can of worms.
Exactly.
Or something like, I want to go, well, why not?
Yes, absolutely.
I know you can't get it right now.
So these lifestyle changes, though, obviously, you know, it's important research that it maybe could reduce cancer deaths. But what if someone wants to be proactive?
Yeah, so
adopting these, does that help?
Absolutely. Number one, obviously, quitting smoking. Obviously, abstaining and limiting alcohol. Also, for our diet, making sure that you're limiting processed food, limiting red meat as well, because we know that that has a known association to increased rates of colon cancer, and protecting our skin. SPF 30 during this summer and all times, as you know, applying it every hour, at least every 2 hours, and then also making sure that you're getting screened. Early detection leads to early diagnosis, and early diagnosis always has a better outcome.
You know, we've got the study now, but most of us have known about these risk factors. We've known about the behavior. Have you seen in some of that research people over the years, last few years, actually adhering to what some of the things they've been told to do?
You know, I think so.
Smoking.
Yeah, we know
down.
smoking. When you look at the rates, in 2011, the rate of smoking was more than 30%. That has substantially decreased when you look at the association to 2022. I think generations are becoming more cognizant of our risk, and I think that that's wonderful and important. But there are new risks that we have to pay attention to. During the break, we were talking about vaping, for example. We don't yet know how that is associated to long-term outcomes. So making sure that you're paying attention to these things, and some of these results haven't been done yet, so we always have to be cautious.
What cancer is tied to the most preventable? I mean, you know, which cancer would you...
Smoking is the
right?
most common cause. Yeah, more than 60% of cancer-related deaths. And again, it's all. So smoking is one of those things where it's just clear and obvious that we have to stop.
So if you're not smoking, you're already winning.
You're already winning. And now we're going to take some more steps, get off the subway earlier, take some more footsteps, you know, stop smoking, limit your alcohol, trying to make our diet as good as possible. These are all things we can all do.